Good afternoon, everyone. I'm Zack Kucharski. I'm the executive editor of the Gazette in Cedar Rapids, and you have joined us for Iowa Ideas in Depth Week, looking at aging in Iowa. It is Monday, and so we are beginning with a kind of a kickoff session that'll cover a lot of topics that we'll dive into greater detail throughout the week. I wanted to give a special thank you at the top to our presenting sponsor, Chris and Susie DeWolf Family Innovation Center for Aging and Dementia at Mercy. Thank you to them for sponsoring the in-depth sessions that we will go to each week. This is an interactive session. We've prepared some questions. However, you have the opportunity using the Q&A button at the bottom of the screen. So if you have questions that you would like to ask our panelists today, you'll be able to post them there, and I will work them in as we go through the conversation. And so I want to go through, and I figured it would be easiest to have each of our panelists introduce themselves and kind of speak a little bit about their organizations and their experiences, and then we will get the conversation rolling. And Anthony, you have the benefit of being top left at my screen, so I'll start with you.
Welcome. Happy to be here to discuss so many issues of aging in Iowa and serving this panel. Look forward to a healthy discussion on where we are with aging, some of the opportunities and challenge before us. And I work with ARP, been here since advocacy manager since 2005 here at ARP Iowa.
All right, thank you. Shannon.
Hey, good afternoon. My name is Shannon Strickler, and I am president and CEO of Leading Age Iowa. We are an association of not-for-profit providers of aging services, and our members provide services along the entire continuum, everything from Meals on Wheels and home health, independent living, affordable housing, to residential communities that provide assisted living, long-term care, skilled nursing, hospice, etc. So great to be with you today. Thank you.
All right, thank you. Eugenia.
Hello there. My name is Eugenia Kendall. I'm the Director of Services to Promote Independence at the Iowa Department on Aging. I've been with the department for a year now, and prior to that, I worked at Heritage Area Agency on Aging for 7 years. Basically, the area agencies on aging help administer the Older Americans Act funding. They provide a whole array of services from, options counseling to find a place to live in the community, to services, connecting to services in the community. I look forward to being a part of this discussion. So thank you.
All right. John.
Well, good afternoon, everyone. I'm John Hale. I and my wife, Terry, own the Hale Group, which is a Ankeny-based advocacy firm that focuses on improving the lives of older Iowans and Iowans with disabilities.
All right. And Larry. Oh.
Hi, sorry, I am trying to log in on Zoom, but the link is not working. My name is Larry Johnson. I'm the director of the Iowa Department of Inspections and Appeals, where we have our health facilities division that oversees healthcare facility regulation in Iowa, from long-term care facilities, assisted living programs, residential care facilities, home health, hospice, hospitals. So thank you very much for having me, and I'm going to try to join you on Zoom as well. Thank you.
All right. Well, thank you, Larry. And I know hopefully we can get that working here quickly. And so I'll start with kind of a level setting question for folks. And when you think about aging in Iowa, there are so many different places that you can focus on, whether it's long-term care facilities, in-home care, workforce, just even your own personal situations. And so I wanted to ask kind of an orienting question. From your vantage point, what is the state of the system today? What's working well? And maybe what needs attention? And so, Shannon, since I went with you number 2, I'm going to do this kind of the panel style. And so I'll start with you this time first.
Okay, that was a big question. So I'm trying to remember everything you wanted to know. What is working well? I think we have a lot of dedicated providers across the state who just have a passion for serving older adults. And so the more we can retain those individuals in the field, have their experience moving forward, that's great. I also think there is a spirit of innovation where people are eager to continue to try new things and deliver services consistent with the needs and preferences of older adults. So those are all positive things as we look forward. And then the other piece of that was kind of challenges. Is that
challenges or opportunities for improvement?
So I would say our biggest challenge is workforce. And when we talk about aging services, we're typically talking about people caring for people. And I do think there's a role of technology, but it is not going to 100% replace people taking care of people. And if we don't have those people, it's hard to expand services. It's hard to offer different alternatives because you just need that fundamental workforce. So I think that's an issue as a state that's continuing to have a growing older adult population that we're going to need to really tackle head on.
All right, Eugenia.
Yes, well, kind of as Shannon said, we have a great aging network in the state of Iowa. We covered all 99 counties. But one of the things that at Iowa Department on Aging we're really taking a close look at is the Americans Health Rankings came out with kind of an alarming statistic that Iowa is 4th in the nation for low care need residents residing in nursing homes. And that's about 16% of nursing home residents that have low care needs. And we also pair that with then about 46% of them are private paying. So these are folks that could largely live in the community with the right kind of support. So we're really taking a close look at this kind of information and how we can best utilize the Older Americans Act funding to meet those in-home care needs.
All right. Larry, I'll jump over to John just in the kind of the order, and we'll come right back to you in a couple minutes here.
Zach, thanks. I'm going to step back and give this more of a global answer. And first, I want to offer kudos to the Gazette for doing exactly what needs to be done in this arena, and that is to talk in a comprehensive manner about aging issues in Iowa. I regret to say this, but what the Gazette is doing is exactly what the state of Iowa is not doing, but should be doing. We ought to be having conversations around the state to talk about what the needs are, what the challenges are, whether it's long-term care issues, whether it's health issues, whether it's food insecurity, whether it's living in small towns and not having access to the services you need. We as a state need to be having those conversations so that we can identify those challenges and so we can address them. That old saying about when you fail to plan, you plan to fail. Those 9 words are kind of indicative of what we have here in the state of Iowa in terms of state government. We're not planning, we're not identifying, we're not creating plans that we can implement. So what the Gazette is doing is what I hope state government will do, and that is to deal with these issues that are huge challenges for people across the state.
All right, Anthony.
Yeah, so I'll kind of bring together, I think a lot of the things have been touched on. I'll just say, agree, when you look at, I'll just say opportunities for collaboration and communication, I think have increased, and a level of resiliency of going through the pandemic, I think has increased those conversations. We need to have more of them, to John's point. I certainly, you can't argue with our 2 big staples that we'd like to see as a better, more rebalanced system that better supports and provides home services in homes and communities. At the same time, acknowledging, I'll be the first to say, we need facilities, right? So, but it's both, but I think we can provide a better balance in home care. We can explore that later. But I would say the number one thing is workforce, right? Our data, we just released this week, our monthly dashboard for Iowa that showed 51% of Iowans, Iowa's nursing homes are going through staffing shortages, and that's the data point we have. We know there's similar status. Probably if we had the data, it would show similar data in terms of shortages of home care staff too. So it's a problem. I will say, and we can explore a little bit later, there are conversations I referenced specifically. I sat in on a conversation led by Department of Human Services last Friday afternoon on what we can do to improve access and support for direct care workers with a job board, and how we can move forward and access to some leverage from federal dollars to do a better job and innovate, like Shannon talked about. So I would agree, workforce is number one area. And frankly, it's the linchpin. If you're going to get into home community-based services, you got to have the workforce there to be able to do it, whatever setting you're in.
All right, Larry.
Yes, right now there are, I would say, some tremendous things that are occurring in the state of Iowa. I was at the University of Northern Iowa on Friday and had a real inspiring visit at their Alzheimer's Dementia Simulator House. And the things that are occurring in the state to protect, elevate the discussion for older Iowans and provide better care is occurring every day by very passionate people. And, and then also I would echo that we are seeing a workforce challenge. In addition to healthcare facilities, we regulate food establishments here, and certainly the hospitality industry, all sectors, manufacturing, are experiencing that with, there are top priorities of focusing this on. We see that in Pella High Schools, getting people young in high school interested in healthcare, but certainly working through the challenges that we have faced. So thank you.
Since several of you mentioned workforce, I was going to figure a couple of our first questions, we would start there. And I think there are probably multiple prongs. There's the care facilities, but then there's also the in-home providers, as well as the current economic conditions. And so I was going to start with just, when you think about the challenges of workforce long-term, I'm curious what we're seeing in terms of coming out of COVID and the interest in remaining in the field. And is this something that folks are remaining excited to do the work? And obviously wages is a different pressure, but what is the kind of coming out of a multi-year pandemic where you're stretched to the brink? What are we seeing as kind of the condition of the workforce who remain there today? And Eugenia, I think I'll start with you.
Sure. Okay. Thank you. Well, we certainly have felt the residual effects of COVID, especially when we try and connect folks to that are needing in-home supports to providers. In fact, some of our area agencies on aging have had to develop some innovative practices, such as rapid response in-home care services to help meet the needs and the gaps, fill the gaps where there are provider shortages. So, because some, providers, they don't want to only provide a couple hours here and there. So it's like, if we can at least fill that gap before they're able to get on another level of care or benefits for the state, then we're happy to do that. So hopefully, as we learn more to be able to provide, homemaker chore services more directly, we'll be able to expand that and meet some of those gaps throughout the state.
And Shannon, I'll jump and kind of go, and others can jump in as you have points to make. But I'm kind of curious. This isn't something that you can opt to provide or not to provide. It's something that needs to be done. And so I'm curious, what are you seeing in terms of workforce? And what is the number one issue that you're seeing within? Is it the capacity and the training, or is it, are there concerns about getting more people interested in this?
Yeah, Zach, I wish I could say one thing, right? Because it would be easier to target if there was like this silver bullet and we could, just tackle one issue and solve the problem. And unfortunately, it's a lot more complicated than that. We have demographic issues. We could speak globally about just the demographic challenges in every field, and how, our country historically, growing employees is how we've measured growth. And we are going to have fewer people of working age. So what's that going to mean globally? We could talk about, people who work in aging services, who work with older adults, are drawn to it. I mean, frankly, because they have a passion, right? Because they enjoy relationships with people. that is something that has been challenging over the last couple of years because, for a while we had some protocols where you were trying to limit access to certain areas of the building and people didn't have the opportunity to have all of that resident engagement that typically, that's the thing that fills their cup up at work. And when you continue to have workforce pressures, it becomes more about tasks than kind of some of those relationships. And so I think just that has been a challenge for keeping workforce happy. I also think that, a lot of the protocols related to COVID procedures have changed in a lot of other areas, right? I mean, if you go to the grocery store, there's not a lot of masking, perhaps, right? In long-term care communities, that is still happening all the time. And and that has just created kind of another barrier to kind of recruiting people. If that's not something they're interested in wearing and doing, it's just one more hurdle to getting people interested in working with older adults right now.
Anthony, you mentioned the 51% kind of in those numbers. And when you're seeing numbers that high that are having staffing issues, I imagine that's not, rural versus, that's kind of systemic when you're talking about staffing to that level.
It is systemic. And look, and I'll elaborate further. That is Iowa. That's Iowa's average as of June 2022, excuse me. And it's 51%. I think the more telling statistic, and I could visualize it put in your screen, if you look at a year ago, so June of 2021, which again, we're in the vaccine phase even then, it was 39% then. So we're actually, even as we're, through the pandemic, are we in the endemic phase? It's gotten worse and it's stayed or plateaued at over 50%. And that's relative, by the way, we're at 51%. The national average is not great, but it is 28% nationally. So I think there's opportunities for us to do better in this space. And I do think, and Shannon's absolutely right. There's no silver bullet. I think it's a combination of certainly wages and benefits. I think understanding, though, I think what all of us agree is it takes a special person to do this and a passion and interest in it. And it takes extra dedication to have stayed with this. So we understand that. I will say, and we maybe explore it later with a related issue. I think so who makes up for this? That, by the way, again, that percentage is just nursing homes in Iowa. We don't have data on the shortages that exist in home care. I can just tell you what we see is there's less home care. I mean, home cares are struggling to make a go of it or not going at all. As someone who with 80-plus-year-old parents up in Northeast Iowa, it's not an option right now. So what do we do, right? So right now, what happens is you have unpaid caregivers who are already the majority of long-term care who are thrust in this situation. We just did an article at ARP about the Gen Xers who inherited a new job that they didn't know or have to be served as caregivers. So are there opportunities? Are there passions discovered by people who do this informally? And last, I'd say kind of, I mentioned earlier, and we can explore this later, is I mentioned this job board that I really give credit to this administration to really try to, what do we do to maximize and recruit people and make it available, what your credentials, what your availability is. Are you recently retired, want to re-enter the space, to make it easier to connect people looking for services, especially in the home, with people who are available. But the last piece I'd say is, I know some community colleges have done this. What can we do to, for instance, make tuition free or reduced for people who want to enter this field and become direct care workers? So I think there's a myriad of discussions underway. I think piecing it together to create, again, not a silver bullet, but really just staying committed to this, because as much as maybe the severity of the pandemic has eased, our staffing shortages has gotten worse and maintained in a not great place.
Zach, if I could jump in here just to provide some context for this conversation. Anthony and I share something in common. We both got in this arena back in 2005. He went one direction, I went another direction. But on the consulting and advocacy side, we've been talking about these issues for at least 17 years, all the time that I've been involved in this arena. This has been a yearly conversation at the State House. The challenges are worse now, but they were bad then. They were bad 17 years ago. They're worse now. We all know it. We all talk about workforce. We all talk about the need to do something. I would submit that until state government says this is a priority for us, we are going to deal with this. We are going to implement the solutions that many, many folks have identified. I'm afraid we're just going to continue to have this conversation. So what it requires is leadership from the state level and a real commitment to talk to folks like Shannon and Anthony and direct care workers around the state and providers of services and Di Finley and others, and just say, here are the solutions that have been identified year after year after year after year. Now we simply have to focus on, are we going to implement them or aren't we? That's kind of where we're at. We know how to solve some of these problems. The key is, are we going to have the political leadership to address them? That's what we're waiting on.
And I'll add one more thing. On the positive side, I'll agree, John. We always need to do more. We absolutely need more. But I'd be remiss if I didn't forget what beyond this this work group I mentioned. Iowa did access and is utilizing federal dollars to invest in rural healthcare providers. Maybe Shannon can elaborate on that, and the home care workers. So we're utilizing those dollars. Now, again, the domino becomes what happens once those dollars go away. How do we replace this fair? But it's important to recognize that is what's new. That is a new thing. Again, it's that will help. It's not going to fix things, but it will help. I don't know if Shannon or someone wants to elaborate on that. But is that accurate, Shannon?
Yeah, I mean, I certainly the administration's made investments in the Medicaid program. I know in 2 years ago, they made a big investment in the long-term care side, which was fantastic. This past session, they made an investment in HCBS services, also good. I think that the challenge is in the era of inflation that we're in, it's really hard to keep up on things. And then, just kind of, I don't want to blame everything on Medicaid, because I do think we need to figure out for ways to pay for services outside of Medicaid, right? Like the payment system for long-term care supports and services is fundamentally broken. And we need to figure out as a country, as a state, how we're going to pay for this, because most people don't understand that these services aren't covered by Medicare. And then when they get to the point that they need them, there's a huge surprise. So we have kind of a lack of general understanding of what services are available, how they're paid for, what resources might be necessary. And unfortunately, those questions get asked when they tend to be in an emergency, right? And so that's not the best time to do our planning. So how can we, incent people to, whether that answers long-term care insurance or some other product we don't even know about today. But how can we also have those conversations upstream so that we're not pushing everyone into the Medicaid system? Because the reality today is Medicaid, it's supposed to be a safety net program. And the more and more people you have on that, and if it's not paying the cost of funding, then that cost gets shifted to people who are paying privately. So, there's a lot of issues here. It gets complicated pretty quickly. But the administration, I think, I do want to recognize that investments have been made there, but there's lots of underlying fundamental issues. And then the inflation just, the costs are really significantly going up.
One thing I just want to add really quickly, just to, for further discussion later maybe, is that this Department on Aging is working with the governor right now to try and get moving on a master plan for aging. These are, other states have done this, Colorado, Texas, Connecticut. They've had huge success in having the conversations that John has been speaking of. And yes, we've needed to have these probably 20 years ago and have been having them ever since, but it's better late than never anyway. So and what we've found is that it will take a whole year of having community conversations, meeting with stakeholders, including all of those issues that we know are out there into a prioritized list of here's an action plan. This is what we're going to do about it. And it's usually a framework that is for 10 years. It will be set the course for making these kind of infrastructure changes, policy changes, everything that we're hoping. So it's on our radar, and we're working on it. So.
Shannon, you put a lot into your answer too, and I want to come back to some of the planning discussions, but I also wanted to ask about inflation and the era that we're in right now. And I'm curious what we are seeing, whether it be family caretakers who maybe have been doing it and aren't able to keep up with what is coming in. And what concerns are you seeing when it comes to inflation, maybe at the individual level, more so than necessarily the providers, and I would imagine the cost of service going up as well, but are we starting to see some of those personal anecdotes increase of I can't afford to stay home and care for, or I can't, are we seeing increases in some of those, or is it too soon to tell?
Zach, if that was directed to me, I could probably speak more from a provider level than from an individual in the community, in terms of, the inability to continue to care at home. I do know everything from, we all know, right? You see it, food, gas, et cetera, all of that is increasing costs, and at the provider level, if you're dealing with a government payer like Medicaid or Medicare, you cannot increase your rates. So, right. That your revenue is locked in that regard. And so these really steep inflationary costs, and then even costs that, we previously didn't have to the same extent, like face masks and face shields and gowns. Historically, that was not an everyday practice. That was kind of, intense flu season, or, it really, specific case of something, but that was not everyday practice. So just the whole cost structure has really changed over the last 2 years. And so I think it's going to be interesting when we start seeing some cost data later this year to see what that real impact was.
Zach, if I could jump in, just add a plug. First of all, if you've not read it and it's in your online, I don't know if it's in your Cedar Rapids Gazette paper edition today or tomorrow, Zach, you actually did an article about this, the inflationary pressures on especially older Iowans. And it's true, our state director was quoted in it, along with, certainly it shows up in the form of food banks, access to food, inflationary, even prior to inflation pressures, the medication prices, the cost of medications have exceeded the already high cost of inflation. So that's a pressure we're trying to work on, and hopefully maybe have some maybe even solutions coming from Congress the next month or so on the prescription drug side. But that's a real pressure for especially older Iowan spending. I would say it's hard to call it the silver lining. One thing, Social Security cost of living adjustments. People, if you're the 1 in 3 Iowans who Social Security is 90% of more of your income over 65. There is was to be a very high cost of living adjustment coming. That doesn't come till that announced that in the fall, but relief can't come soon enough for people. And I will say one thing, I know it's another area we want to discuss briefly, is transportation, but it does show up in the form of people going to less appointments, right? Gas prices are real for everyone, but it means making the difference. Is it really worth going to that follow-up appointment? Can I call in? Thankfully, we've got technology that kind of bridges that gap, but certainly it is, you're absolutely compounding the pressures that you see for people to stay home, not go out of the house, not eat out as much, which are important for your mental health.
Yeah, Anthony, and I apologize. I should have also mentioned, I know from a community setting, we're definitely seeing an increased demand on Meals on Wheels. People who need additional meals, and trying to find ways to provide those services. And I'm sure Eugenia, since the department issues the funding for that, can speak to that directly. But we see that on the ground level.
All right, Eugenia, did you want to add anything in there?
I'm sorry, I got a message right in the middle of that. So
Nope, no worries, no worries. Okay,
Meals on Wheels. I think Shannon had brought up Meals on Wheels, Eugenia, and kind of the pressure showing up on inflation there.
I mean, certainly there's, kind of each AAA kind of contracts with the providers to set their own rate. There's been conversations about trying to have kind of that one set rate.
Or even increased demand from the
yeah, absolutely. We have also, well, we've actually implemented additional services like Iowa cafes, where folks can, have other options instead of just going to a congregate dining center. They can go to a restaurant, be able to have more options for their food, having ethnic options as well. During COVID, we had kind of these grab and go meals, so they didn't have to have that contact. So there's been a lot of more innovation that's happened due to COVID and yeah, with these other kind of the cost for purchasing food and delivering from the traditional congregate site setting.
All right. Well, I wanted to change gears a little bit and talk a little bit more on the enforcement side of things or complaints. And Larry, I'll bring you in on some of this, but obviously in the heat of the pandemic in the early days, Department of Inspections and Appeals, which is responsible for going in and looking at complaints, the federal rules were not to have inspectors in there. I'm curious, that's gotten some scrutiny of late through the Iowa Capitol Dispatch, and looking at kind of the length of time or the age of some of those investigations. I'm curious, what are you seeing in terms of bringing folks back in and what they're seeing in the facilities? Oh, Larry, you're on mute. Oh, there you go.
Okay, great. Sorry, it's connected to my phone. It's my birthday today, and I have had my computer has just decided not to work for me, so I apologize. I thought I'd have better luck today, but Zach, thanks for having me, and it's a pleasure to be here. Yeah, you summarized it very well. When the pandemic hit, Iowa, we are in charge of the regulations, but we are contractors. That word, I don't use that in the legal sense, but in the practical sense, we are contractors on behalf of the federal government, Center for Medicare and Medicaid Services. So 432 long-term care facilities are certified by the federal government. There are about less than 4 that are not. And so we do work on behalf of the feds. And on March 3rd, they said, all right, everyone get out, all inspectors get out in the long-term care facilities. And then they brought back in, we could get in there for very few specific type of complaints, immediate jeopardies. And then they introduced a focused infection control survey. And so every long-term care facility had to have a focused infection control survey by July 31st of 2020. So we were in facilities, but we could only do certain type of surveys. And so then as the pandemic continued, we had to get in there within 3 to 5 days of a known outbreak. And so the amount of survey activity we were doing, again, it was focused on focused infection control, but we were in those facilities because the feds did prioritize that type of survey activity. On January 4th, of 2021, the Fed said, hey, why don't you, or they changed their prioritization to recertifications to complaints, but they did shut down most of the surveys, so there are backlogs. So right now, what is occurring is that we are going into facilities. We're bringing in more complaints than usual. It is not atypical to see a survey come in with 15, 16 complaints. We want to make sure we're addressing all the complaints. They're not wiped out. We have to address them. We want to make sure that facilities are in compliance, that facilities are safe, facilities are safe for the residents. So that is really important. So that is what we're seeing right now. The Iowa legislature appropriated about $300,000 for us to assist with the backlog, but that's a matching, so that makes us eligible for about $2.4 million. So Iowa, our department here at DIA, we were eligible for the full allocated amount of $2.4 million because we've met the performance measurements of the focused infection control. So, and Iowa isn't unique. We have contractors. We have 2 contract companies to come in and help us with that recertification activity. And so that funding was eligible to us July 1st. Because we had worked with stakeholders, with the governor and the Iowa legislature, we had anticipated it. So we got started with our contractors earlier. So to the residents and to the facilities, you will see an increase of facility activity. And also CMS, they're the ones that also dictate what we look at. And so they are ever changing it. The vaccine mandate, we had to come in and do a vaccine mandate evaluation every complaint, even if it had nothing to do with infection control. So they changed that. So Shannon can talk about, from a regulatory perspective, the regulations are constantly changing. So that is something that's just going to take time as the feds change the regulations. They are trying to listen to see what's going on in the ground. They run a 50-state program plus several territories, but we have incredible inspectors that were in facilities from the start doing focused infection control, and they're going to continue doing the work to ensure that residents' concerns are addressed. So Zach, I appreciate the question.
Does that 2.4 million that you're eligible for mean there will be more inspectors in the facilities?
So yes, in the sense of that is one-time funding. And so that is, we are making sure that we are hired and fully staffed. We continue to do that. Hiring of long-term care surveyors is a priority of our department. And then you will see contract surveyors as well. So there will be just, for example, last month, typically we do 32 recertification surveys a month. We had over 42 last month. We had, I believe, 239 complaints that were investigated in a month. So you will see more surveyors and more facilities being surveyed at a time, more surveyors across the state and facilities as well.
Is there work being done to make that, you mentioned one-time funding, but to find ways to fund that permanently, or?
So that was for the backlog. And so we are in continued conversations with CMS on, okay, now, and that's where our performance measurements are based on, that when the federal government came in and shut down most of the survey activity for a year, how do we address that and keep that on a go-forward basis? So those are kind of really 2 issues of how do we get through the backlog, and then how do we stay current? And I'll tell you, in March of 2020, Iowa long-term care facilities have to be certified on a 12.9 month basis. When I came in 2019, we hit about 15 months. And so that was high. The week we were, that CMS stopped recertification surveys and stopped most survey activity, we were scheduling at 11 months. So we were a month and a half under the federal requirement. So those, the question of what is the new normal, I think we won't ever look back at what we were doing before. COVID is here to stay. Healthcare has changed, workforce challenges. But as we look forward, what is that workload of state survey agencies? And again, CMS they launched phase 3 of their long-term care regulations, which Shannon is at about 3 years overdue, 2 to 3 years that we've been waiting for phase 3. So we're going to continue to see that and work with the Iowa legislature on making sure that we have sufficient staff. But that funding was for the backlog that was under the CARES Act. And we are working to make sure that backlog is caught up within the time measurements or exceed them as outlined by CMS.
Okay. All right. Well, I don't want to grind everyone else. I think, Larry, as we talked about COVID, though, COVID obviously changed the norms. And I'm curious if coming out of that, you see an opportunity to kind of innovate or change. And I'll ask each of you this question. If there was a COVID improvement that you could make, or that you've learned through COVID, a policy change that you would make, what is it? And Larry, I'll stay with you quickly and then jump to the others. And you have legal
Sure.
autonomy. You can do what you would want to do.
I would say technology has just probably been, certainly there are negatives to it, but there are positives. And that's one thing when we talk about home health, keeping residents inside their home, not from a regulatory perspective, but I know Department on Aging and Iowa Medicaid are really innovating on allowing families to utilize technology to make sure they're safe and keep them in their home. So that's something that we're kind of aware, but you'll see that theme consistent. One thing that we were doing that we prioritized is making sure our surveys are paperless. Just there was so much time that was being lost with mail and things like that. Our training, when there is a lot of turnover in the private sector, but as the regulator, certainly we see turnover. We had, people retired that were thinking about it. And so our trainings, instead of bringing everybody, we're a statewide program, we just can't bring people to Des Moines to do training. And when you have federal regulations that change every 2 to 3 weeks, making sure that we're consistent and having these Zoom calls, turning on the camera, except when your technology doesn't work, making sure that we as a regulator are consistently, accurately applying, are making sure our inspectors, our surveyors are tooled, are prepared with the right tools and updated information, so that way we can apply it consistently throughout the state. So I would just say technology has pushed us as a government, has pushed us in a very good way to make sure that we're utilizing it and being as efficient and effective as possible.
All right. Shannon, is there a change that you would enact with the lessons learned in COVID?
Well, I think the whole concept of telemedicine was just essential. And I know our members really appreciate both the ability, just the sense of if you have a frail older adult in a long-term care setting, the ability to do certain appointments via telemedicine instead of having to transport someone across town, for a quick check-in, that has just been so much more efficient and better for the resident and their health in terms of not having those transports. So I think that the whole concept of telemedicine has just been probably the biggest change. I also think it's a payment concept, but it's called the 3-day stay. And it essentially, in order to receive access to a skilled nursing benefit under Medicare, you have to have a 3-day stay in a hospital. And that requirement has been waived. And that's allowed patient placement kind of in the right setting at the right time without some kind of regulatory administrative hoop people have to jump through. And so I think we've been trying to change that for a while, and COVID has kind of been a test that, hey, guess what, that works. So I would love to see that stick around as well.
All
right. Anthony, how about you?
So telemedicine and I was asked on a previous interview is, providing some type of long-term care services, follow-up services remotely is the way of the future. It's now. It's happened. And I think Director Johnson and Shannon just touched on this very much so. It is certainly a huge bridge, whether you're in a home or you're in a facility, to do some of those visits. It's important. It's good. A broadband. So that's kind of like what's happened. Broadband, by the way, is something that Iowa has really stepped up, you talk to people anecdotally, circle this, the last 2 years, the number of people who've had been now offered in rural areas access to high-speed internet, which is so key. And it's so key not just for telehealth visits. My wife and I utilize this. Another important part is reference unpaid family caregivers. To be able to allow to be a unpaid caregiver for my family, my parents, and work remotely, you have to have access to high-speed internet so you can do your job. So those type of things that happen, you're asking. I know your question is what maybe waving the magic wand. I'd put it around reimbursement for both on the home health side of things, both adequate more reimbursement for home healthcare providers. I think rethinking, as I just referenced, family caregivers, how we compensate family caregivers. We have a couple programs in Iowa for different population, or consumer choice option and SEED Act options, which are ways to get paid as a family caregivers. But we need to do more of that. We need to acknowledge the sacrifices people make as family caregivers to go from full-time to part-time. That's happening. And I'll end on a positive note. I reference, again, people being these family caregivers. I think you see this, I've seen this in my circles and my families, the symbiotic relationship of grandparents taking care of grandkids because their kids have jobs that are struggling with access to childcare. And then so there's the adage of who's taking care of who, because I've seen it personally, and so many families, I think, have seen the spark of keeping your families even closer, living nearby. I know housing is, I don't know if we're gonna have time to get into housing, being able to live nearby, but the symbiotic relationship of grandparents stepping up and providing childcare, and then the joy and the satisfaction that comes from having young kids in your home, because what technology can't bring and actually can contribute to is isolation. Yes, it's nice to be able to not have to leave your home, but people need to be able to leave their home or connect with people. So I'd say that's as a positive opportunity. It connects back to my ask, which is more compensation, both for the formal and informal side of home care providing.
All right. John, if you had the magic wand, where would you wave it? What would you do?
Well, I would start by just agreeing with Shannon and Anthony. I think we've seen a lot of innovations here forced by COVID. Unfortunately, wish we would have done it without COVID, but the aspects of telehealth and technology that Larry referenced, I think all of those are critically important. But if I could, Zach, I feel like a presidential candidate in a debate saying, I'd like to go back to the previous question and answer that. If I have that liberty, I think, and I don't want to point the finger here at Larry, because he's working in a bureaucracy and he's got to do what the feds tell him to do, and he's dealing with state resources. But I think from a consumer perspective, just looking at this from a consumer, a family member who has a loved one in a facility, the fact that there are that many cases that haven't been investigated that are over 120 days old, the fact that there are cases that haven't been investigated for over a year, that really is just fundamentally unacceptable from a consumer perspective. We got to do better than that. And I think in listening to Larry, the feds have been part of the problem here in terms of what they have asked or required regulators to do. I think we need to revisit all of that, but we need to do better than what we've been doing. And the other thing to think about is, while we're talking about facilities where there is a process to routinely investigate complaints and to periodically just do routine investigations, on the home and community-based service side, we don't have anything there. So while we can be critical of the fact that what we got on the nursing home side is not doing as well as we would like it to do, we also have to recognize that we need to take a serious look at that home and community-based side. And how do we respond to complaints from people? How do they even make complaints to people if they have concerns about the people that have been providing services to them? It's long-term care is more than just nursing homes. We got to take a look at the big picture here. And I hope that as this unfolds down the road at the state level, at the federal level, we can take a look at that long-term care ombudsman's office, for example, see what they're doing, see what their resources are, and see if we can move some of their resources or add resources so that they can do more on the home and community-based service side.
All right. Eugenia, do you have thoughts?
Well, just a couple of things I want to add to that. Again, great responses from everyone all around. One thing that really helped us during COVID was to have funding flexibility, because we had to change services so rapidly. I mean, we had to shift the whole entire, funding allocation from congregate to home delivered meals, and that was, having that ability to be flexible with the funding was huge. We also saw that needing to actually serve folks virtually was, something we quickly adapted to. But a lot of the evidence-based programming that we provide did not have, online capability yet. So it's like we had to kind of get up to speed in that respect and wait for those kind of, opportunities and modules to come out. But we did, like Anthony said, with the increased broadband is a huge issue. And yes, we're getting further along on that, but I think we still need to do more in those rural counties. We have introduced some innovation in terms of like getting grandpads. So they're kind of the iPads for older folks that's a little bit easier to use, that kind of thing. So we've implemented programs that help to get the technology in the hands of our older adults when they needed to use it within, case management or just wanting to connect with their loved ones during the pandemic. So probably an expansion of that effort would also be good. But in terms of the policy and, definitely, again, I echo increased funding for HCBS services, and definitely more supports for and compensation for our caregivers.
I wanted to go back, and I've learned the hour goes very quickly. And so there are a number of topics that we'll dive into greater detail as the week goes on. But I wanted to go back to the point made about planning and finding information out and kind of easing off of the Medicaid dependence. And, is there more work that needs to be done in terms of the planning to understand some of those costs? And what changes would you make so that folks have a more realistic plan in place before it's completely reactionary?
Zach, I'll jump in here. And I think the answer to that is yes, people absolutely need to do more to plan and prepare. We are people as Iowans and as Americans, we live in a state of denial as to how our lives may unfold down the road. As we often say when we're talking to groups, people do a pretty good job of planning for death because they know that's a given, but they do a pretty crappy job of planning for decline because they don't want to think that that's a possibility for them. And so I think there are huge opportunities here as well as needs. And I think through the AAA network and through efforts of organizations like AARP and whether it's leading age providers, we can all do a better job of encouraging people, if not forcing people in some way or another, in a nice way, to think about and plan for their not end of life, but their progression of life. What might happen to them? Where would they want to go if they need services? Do they want to stay at home? Are they perfectly comfortable going to an assisted living center? If they need a family caregiver, who's going to do this? Who do they want to do this? And as Shannon has pointed out, how in the heck are we going to pay for this? And as Shannon pointed out earlier, most people are under the impression, well, we've got Medicare and Medicare is going to pay for that. Well, that's not a good surprise for them when they find out that that's not the case. So I really think we need to view this as a state. This is a significant challenge for Iowans across the board. We need to do more with that. And I think if we simply say we're going to do more with that and task the AAAs, fund others to do it, we can get it done and help a lot of people.
Well, and John, I just offer that more fundamentally, besides educating and counseling people, I mean, we need better options on how to pay for things, right?
Yes,
so
totally.
It's not just, I'm going to counsel you to do this. I mean, I don't know if we can point people to great products right now. I mean, we really need to have some development in that regard. And I don't want to dismiss that education is not important, because I think, a lot of people think that, it's kind of maybe home care, or, you know, they think of old style nursing homes, right? Like that's their options. And, you know, there are so many different options for services out there, and consumers just don't really understand that unless they've navigated the system. So what about an adult day program? What about PACE? What about, I mean, there are a lot of things out there that can support people where they are according to their needs and preferences. It's just a matter of understanding and getting access. And to Eugenia's point earlier, there's not enough of those, right? So in rural areas, I don't want to paint the picture that, you know, all those services are available and plentiful. We definitely need to build that out more. But I think there is a lack of just public understanding in terms of the types of supports that people could benefit from. Frankly, maybe until too late, you know.
Well, one of the gaps that we had also seen was folks just being able to return back into the community if that's what they wanted. So we developed an Iowa Return to Community program that allowed folks that were either in a nursing home situation, a rehab, or, you know, make sure that they have the right supports when they do move back into the community setting. So, but we'd really like to be able to expand those efforts because it's needed throughout the state, not just in our kind of pilot communities.
I'll just simply exit around time. It is, I mean, it's both. Shannon is absolutely right. There needs to be better products, but it's connected to John's point too. Having a state plan and working on this is so key, but it does start with the individual and frankly, our own biases of that is denial. I mean, against my job to help provide education, certainly the AAAs are the number one in that, thinking ahead, to planning for long-term care and rethinking long-term care. But I had this conversation twice. One with someone personally and someone obviously in this professional aspect where they thought of home health care as hospice, right? Which hospice is important, but there's still a cultural, I don't want to think about it, that we just have to keep chip away at it. And I think if you're on this call attending, it starts with you as an individual. It means you're more likely to have had a conversation maybe about power of attorney or funeral, having a conversation. So thinking about saving and maybe starting small with, do you have someone come in to do chore services and clean? And then again, I'm cheating now and asking for an extra wave my wand, not just more money for home health, but help rethinking what it means to someone who works in a home and making it easier to be flexible to move from a facility to home care. Some of those barriers that exist, frankly, federally on moving from a CNA to home health care, making it easier to do so. But it does have to start with challenging people to have the conversation personally, and understanding that by not talking about it, ironically, you're losing your ability, your options to plan for it and frankly help save up. So we're not just waiting for Medicaid to step in and pay for it.
Right.
All right. Well, I've learned how quickly an hour goes and how complex this topic is. And there are a lot of topics we didn't even dive into. But as the week continues, tomorrow we have a deeper conversation about the home community-based services. Wednesday, long-term care facilities. Thursday, making your home a place to age in place. And then on Friday, we conclude the week-long in-depth series with poverty and some of the issues and challenges there. And so I would like to thank all of my panelists for spending an hour with us today, and on behalf of everyone here. So thank you for that. Iowa Ideas, the conference, will be virtual again this year. It's October 13th and 14th. We are building the schedule right now. iowaideas.com is the place to find more of that. I would encourage everyone to jump into as many of these sessions throughout the week as you can. We're at noon each day. And so thank you to our audience as well. Have a great day, everyone.
Thank you.
Thanks, Zach.
Thank you.
Thanks, everyone.